Okay, good evening friends. Today we are going to discuss a very important topic, that is the carcinoma of the breast. This is a very common problem that is occurring in women nowadays. And what is it and what are its symptoms? We will be going to discuss that. So when the cells under one of the or both the breasts, it grows out of control, and when it spreads beyond the breast, then it is known as metastatic, and that condition is known as the carcinoma of the breast. यानी कि जब भी जो सेल्स हैं ब्रेस्ट के या ब्रेस्ट के अराउंड ओवर आउट ऑफ कंट्रोल ग्रो करने लग जाते हैं, दैट मीन्स उनकी मल्टीप्लिकेशन इंक्रीज हो जाती है, and then due to that it increases and then they spreads towards other parts of the body. That is the term used for metastatic, and that is known as the carcinoma of the breast. Now usually the carcinoma of the breast is of two types. That means the lobular carcinoma and the ductal carcinoma. Now what is lobular carcinoma? Lobular carcinoma occurs in the glands that make the milk in the breast, whereas the ductal carcinoma is that which carries the milk to the nipple through the ducts. So अगर इन दोनों में से which part of the breast is involved, depending on that it is classified into two types. That means the lobular and the ductal. Now what are the symptoms of the carcinoma? Now the most common symptom that is usually observed in the initial stages of the disease is a lump or a thickened area near your breast or under the breast. It usually occurs during the menstruating or periods of the women, and at that time this lump is more prominent. It may also be present as a small mass, like a pea-sized mass, on any part of the breast or around the breast. Sometimes the skin is also inflamed, puckered or scaly with redness because there is inflammation of the skin. And sometimes there may be discharge through the nipple, which may either be bloody or it may be clear fluid. Sometimes as the carcinoma progresses, then what happens is there may be a change in the size of the breast, the shape or the curve. It may also become as a inflammatory puckered skin, or there may be wrinkles present. Sometimes a hard marble-like spot may be seen on the skin around the breast. So these are some of the common symptoms which may indicate that the patient may be having carcinoma. Now there may be pain present, and sometimes that pain, if it is in advanced stage, then it may get referred towards the underarms. That is because the lymph nodes get involved there. Or if it is metastatic, that means it is spreading towards other parts of the body. Then depending upon what parts of the body are affected, this carcinoma, metastatic carcinoma, may produce symptoms depending upon what organs are involved. Now what are the types of the carcinoma of the breast? Now first is the in situ carcinoma, which is known as the ductal carcinoma in situ and the lobular carcinoma in situ. The short form is DCIS and LCIS. Now what does you mean by in situ? In situ means that the carcinoma is present only in the breast. It hasn't spread around on the adjacent structures as yet, and it is involving the ducts or the lobules, and depending upon what is affected, like is it the duct that is affected or is it the lobules that are affected, it is classified into these two types. The second important type of carcinoma that is classified is the invasive carcinoma. Now what is invasive carcinoma? Invasive carcinoma is basically when the carcinoma gets affected, starts affecting the surrounding tissues around the breast, or it starts spreading to other parts of the body. Now this is classified into two types, that is the infiltrating ductal carcinoma and the invasive lobular carcinoma. Now this is known as the ductal or infiltrating ductal carcinoma. Obviously from the name we can know that it is involving the ducts of the breast, and the invasive one is the one that is involving basically the surrounding tissues along with the breast. Now this invasive lobular carcinoma is further subclassified into 4 or 5 subcategories. Now these are classified depending on what type of the tissue is involved in the breast. For example, the first one is the adenocystic carcinoma. Now adenocystic carcinoma is basically that the adenocytes or the cysts are formed that affects the breast, and that is resulting in that problem. Second would be the low-grade adenosquamous carcinoma, which is a slow-growing metastatic carcinoma. The third is a medullary carcinoma. Why it is called medullary? Because it is a squishy mass that is present in the breast and it resembles like the medulla of the brain. So that's why it is known as the medullary carcinoma. The fourth one is the mucinous carcinoma. Now what is mucinous carcinoma? Basically it involves the mucinous, like it is a very mucus like of tissue that gets formed due to the spread of the carcinoma, and it looks like mucus, and that's why it is known as the mucinous carcinoma. And the last one is the papillary carcinoma, in which the papillar, that is the area around the nipple basically, they form puckered papillas or prominent nodes around the breast, and that is why it is known as the papillary carcinoma. So these were the two major types and then further classified into their subtypes. Now what are the factors that can control or affect the breast carcinoma? Now it has been seen that depending upon a woman's physical activity, especially those women who have a sedentary lifestyle or who are having or have a lifestyle which involves eating very fatty foods or very unhealthy diet, in those cases the chances of getting this is increased. Then also obviously with the diet, their weight is if increased, then they have more chances of getting carcinoma of the breast. Also in women who consume any kind of alcohol, drugs or smoke, they also have more chances of getting affected by this. Then those women who have gone or have used hormones for any of their other medical conditions, or for example for hormone replacement therapy, or if they have taken hormones for some other conditions of their body, and due to that hormones they may develop secondary carcinoma of the breast. And the last one is the reproductive history, where if the woman has her first child before 30 years of age, or if she doesn't breastfeed her baby, or even there is premature early pregnancy history present, then in those cases also this problem is seen to be more prominent or more chances of getting the carcinoma of the breast. Now, what are the tests that are usually done to diagnose this condition? Now, usually the most common tests that are done is obviously ultrasound of the breast. MRIs are done to see how far the carcinoma has spread. Mammographies are usually the initial diagnostic test that is done to see if it is carcinoma or not. Then there may be biopsy, that means which is further subclassified into fine needle biopsy and core needle biopsy. Now the fine needle biopsy is basically like a small fine needle is inserted into the breast and a small amount of the tissue or fluid is taken out to study it under the microscope. Or the core needle biopsy is also taken, in which some other deeper tissues are taken to see if they are affected or not by the cancerous cells. Then the fifth one would be the surgical biopsy, and the last would be the lymph node biopsy. In this, basically the lymph nodes from under the arms is a small biopsy or tissue is taken through aspiration needle, and then it is studied under the microscope to see if it is affected or not. Now, what are the stages that are or the carcinoma? It is classified into various stages. These stages are subclassified into various further categories depending upon what tissue is involved, where the carcinoma has spread, and whether it has metastasized to the other organs or not. For example, in the early stage 0, this is a non-invasive carcinoma. That means it is only present in the breast and it's the very early stage of the cancer. Then stage 1 is the carcinoma, which is 2 centimeters or less in size, and it hasn't spread to other surrounding tissues as yet. The third one is the stage 2A, and the fourth is stage 2B. Now stage 2A, in this the nodule is smaller than the 2 centimeter across, or in the underarm lymph involvement may be present in this, or it may be larger than 2 centimeters but less than 5 centimeters across. Here no lymph node involvement is seen. Then in the stage of stage 2B, that is larger than 5 centimeter across with no lymph node enlargement. Then comes the stage 3A and 3B. Now in the stage 3A, locally advanced cancer which is larger than 5 centimeter, and the underarm lymph nodes may be present, or the bone is involved, or any size of tumor with a sticky lymph nodes is classified as 3 stage A. Then stage 3B is basically the tumor that spreads to the skin and the surrounding chest wall. Now the next stage is the stage 3C. In this, any size tumor can be present, that is, it is not necessary that it is 2 centimeter or 5 centimeter across, because it's already started spreading to the surrounding breast. So any size tumor which spreads further and involves more lymph nodes, that is also classified as the stage 3C. And the last stage is the stage 4, where the metastasis is completely present. That means it has already spread and is the last stage of the carcinoma, which is the most invasive and the most serious one. And it is that the metastasis occurs to the different parts of the body as well. Now this may occur, like for example, it may involve the surrounding lymph nodes, it may go towards the brain, it may affect the spinal cord, or to the organs such as the stomach, the liver, the kidney, or any other organ, depending on how fast the cancerous cells are traveling through the blood and which organ is more susceptible to this spread of the disease. The last is the treatment, like what is the treatment that is done to treat this carcinoma of the breast. Now first one is the breast conserving surgery. In this, the doctor usually does is to preserve the basically the spread of the disease by preserving the breast itself. Like if it is a very initial stage and it is just confined to a small part of the breast, then they will try to conserve the breast from removing it completely. The second would be the lymph node removal surgery. In this, basically, if the lymph nodes of the underarms are involved, or if the lymph nodes around the chest get involved, or the cervical lymph nodes get involved, so in those cases also this may be done to remove those lymph nodes, to remove this. And then the third one is the mastectomy, which is the most common one that is done usually. And that mastectomy is done depending upon how much the carcinoma has spread, whether it is still localized, whether the patient wants partial removal, complete removal, or it is a radical treatment. That means the carcinoma has spread completely to the other parts of the body and the patient is in really ill health, and in those cases the radical treatment is taken. Partial treatment is taken where some part of the breast is removed to conserve the remaining breast. Also there is modified radical treatment, in which there is some modification done in the radical treatment. That means they might do reconstructive surgery later on in the following steps, so that the women don't feel that low confidence because of the removal of the breast. Or in some cases there may be some other issues as well, and if their mother is she's a young woman that has this problem, then obviously cosmetic factors are taken into account, and depending on that the modified radical surgery is performed. So this was a complete session on carcinoma of the breast. And if we talk about the allopathic and homeopathic management, then we have already discussed about the allopathic treatment, which is usually the surgery. Now let's talk about the homeopathic management. And in the homeopathic management, we have really good medicines for that, and that includes basically the medicines that are given depending again what part of the organ is involved, how much this carcinoma has spread, what are the associated symptoms that are present in the patient, and if the patient has any other concerns or there are some psychological and mental problems the patient is facing due to that, or what was the causative factor that initially started this disease in itself. So all these factors and a complete case history is taken before deciding like what treatment has to be given and which medicine has to be given. So in that case, basically, if you mention a few medicines, there are lots of medicines that are available, and it's completely based on strict individualizing factors of the patient. But some medicines such as Rubin, some medicines like Phytoleca, then there are some other medicines which are extremely useful in some initial stages. However, it has to be noted that if the disease has completely progressed and the pathology is very advanced, that means that the patient has, the carcinoma has already metastasized to the other organs, and it is the stage, for example, the stage 4, 3B or 3C stage. Then in those cases, both allopathic and homeopathic treatment has to be done to manage both the chronic problem as well as to manage the acute condition. So this was a small information about this carcinoma of the breast, and I hope you got some good information on that. And thank you for watching and have a great day.